This is a Red FM Vancouver podcast. Make sure you hit subscribe for more great content. For further info, log on to redfm.ca.
Minister, good morning.
Good morning, Harjinder. How are you? Happy BC Day.
Oh, thank you. Happy BC Day is coming. So, since people are listening to you and Dr. Bonnie Henry, long weekend is coming, Mr. Dix. What would you like to say to the people?
I'd like to say to people that we still have a pandemic, COVID-19, that there's still no cure and there's still no vaccine. So to be very careful, especially in going to any event, no matter what the size, in a house or anywhere else, where you don't know everybody and you have vulnerable people with you, that this is not the weekend to be partying, and it's not the weekend to be partying with alcohol. And we have a relatively low level of transmission compared to everyone around us in BC. There are 5 people right now in hospital with COVID-19 compared to about 20 times that many in per capita terms in Alberta. So that's good news. But we've seen 2 large outbreaks really in the last week, one around Kelowna, which was connected to parties, essentially private parties, and one at a workplace in Abbotsford, which now has 59 test positive cases at it. And family members may well be affected in addition to that, as well as a case in Haida Gwaii. So we need to remember our COVID sense. And this weekend, we got to make sure we do everything we can to flatten the curve, because it depends on all of us. The surgeries, the visits to long-term care, the schools, the opening of the economy depends on our ability to keep flattening the curve in BC.
Please tell me that you're right on time on the new hospital plans in Surrey.
We're right on time. It's fantastic. This is going to be a transformative project, not just for Cloverdale, but for all of Surrey. We're rolling. I love this project, and as you know, we're looking to announce the business plan with all the details in December. We may have more information before that. It's going to be it's a fantastic project, and Fraser Health is working full on the project.
Since we have received $2 billion from the federal government, any amount of money from this will go towards the hospital?
Won't go to the Surrey Hospital. It's going to the COVID-19 response, right? So we have a number of very important things in healthcare and the economy to do to support things such as TransLink, for example, to support all the healthcare measures we're taking. We've spent, for example, more than $100 million on PPE since the beginning of the pandemic. We're going to be doing a major immunization campaign in the fall with respect to influenza. We have many added costs because of COVID-19, and so that money will be applied to that. But we don't need their money for the hospital. We have a budget for the hospital, and it's proceeding.
Minister, you probably already know that communities are supporting an 11-month-old baby, Adrian Dix, from spinal muscular atrophy. He's suffering from that disease, and you've been you're a kind person. I remember, I think it was a very expensive medicine. You got it for a university student. So this Adrian Dix, this baby is suffering. Any way that your department can help him?
Well, first of all, spinal muscular atrophy is a very, very serious illness for children and condition for children. And everyone going through that, our heart goes out to them. In the last year, we've approved a drug called Spinraza, which is a very expensive drug. It costs $750,000 in the first year per patient, and then in subsequent years, about $380,000 just from memory in subsequent years. And so that is being provided to many people in BC with not that there's many people with spinal muscular, but a large number of the people who have spinal muscular atrophy in BC. So
that's why your name will be written in bold letters in the history of the health ministers of BC.
Well, no, but this is the reason we approved Spinraza is we have an evidence-based process that recommended its effectiveness, and we found the budget room to see it happen. So that's Spinraza. There are other drugs that people are looking at as well that aren't yet approved in Canada, and that's and they have to go through the same evidence-based process. But certainly, we're very concerned, both with everybody all the children who are dealing with spinal muscular atrophy. It's the reason.
So spinal muscular atrophy medicine is not approved here in BC yet?
No, Spinraza is approved, and other medications approved, and obviously people at BC Children's and other places do extraordinary work with people, but this is a very difficult condition. There are drugs that are coming onto the market in other jurisdictions that are not approved in Canada yet, and those drugs will be reviewed just like Spinraza was. But we follow the science on these questions. Like, it's not, I'm the health minister. I'm not an expert on the effectiveness of drugs. And so what we do is we let the experts make recommendations, and then we move from there. And in the case of Spinraza, of course, we did that, and that may well be the case for other drugs in the future. There are a lot of expensive drugs coming on the market, and we do have to do something about that as well, because I think the price for expensive drugs is being set very, very high so that nobody other than health systems could possibly afford it. And that's a problem. So you have sometimes individuals who want to seek treatments, having to fundraise for drugs and so on, that are not yet available or are extraordinarily expensive and whose effectiveness hasn't been proven. So there's all of that. That's a very difficult area, but at least in the case of one significant drug, Spinraza, we've moved in the last year.
So are you in a position to help this child somehow, or your hands are tied?
Harjinder, just to be clear, I don't talk about, you notice I didn't talk about the individual case, because I can't talk about individual cases in public. Right, and for good reason, for the privacy and so on. What I'm saying is that when we're talking about drug approvals, and I think that's one of the issues we're talking about, there's a process based on the evidence that goes forward with that, but they have, in the case of spinal muscular atrophy, led to the approval of a very significant drug. And I can't comment on the circumstances of this child, because I'm the Minister of Health, and what's confidential stays confidential. But I of course hear the issue, and my heart goes out to the parents. And I know that people, I'm sure at BC Children's and in the healthcare system, are working hard to support them.
And also, Minister, we heard that back to school plan. Now, are you satisfied with this? Because masks still are not the mandatory part of this going back to school.
So, a lot of children haven't been in a classroom since March 20th, right? The end of spring break. And 200,000 of them did go back in June when we reopened schools in June. And we learned a lot from that. And so this week, Education Minister Rob Fleming, I think you talked to him yesterday, and Dr. Bonnie Henry and others laid out the sort of framework for how we're going to deal with the reopening in September. And there are, of course, lots of questions about that. What we're trying to do is effectively within schools create smaller schools. So within schools, so elementary schools, a maximum of 60 people that you could possibly interact with, and in secondary schools, 120 people. So we're trying to, when we have schools of 2,000, we're trying to make those schools smaller to limit the possibility of transmission. And if there is transmission, and we don't want that to be the case, but then it wasn't the case in June, to be able to limit it. So that's the plan, and I think it's a good plan. And I think there's a lot of work to do, but this, we've had, our hospitals have been open throughout this, and we're now doing more surgeries this July than we did last July. Well, COVID-19 is going on. So what we have to do is adapt and adjust and follow the evidence. That's true of people who work in trucking and people who work in construction who had uninterrupted work in those periods. And they did that because we worked with those industries, and it's not been perfect. Grocery stores have stayed open, and there's lots of anxiety sometimes. I don't know if you feel anxiety going to the grocery store. I do sometimes.
It is,
right?
yeah.
And so we can do this in education as well. And we have a framework that's been guided by the public health officer. And a lot of people are working very hard on it. And obviously, we now have July 31st, and there's going to be lots of work to put this in place on the ground. And, we have to go into that with real open minds and do our best for children, do our best for teachers, and do our best for support staff and for parents. And I think the plan does that. But we got a lot of work ahead of us.
Minister, tonight is an all-night party on the third beach of the drum party. What would you like to say to those party goers tonight?
Well, first of all, it's not the drum party. Remember, the drum party happened, I think, on Tuesday, and they had the drum party that everyone saw on the internet the week before, and this week it was much better.
It is on third beach, the same place, though.
No, it was much better, but it's not the drum party. I mean, the drum party happened on Tuesday, and they did a better job, I think. There were relatively few people. But this has been advertised, and here's what I'd say to everybody. Don't go. And obviously the authorities, people are talking about all-night parties on Third Beach, are going to be looking at that and involved in that. But I say to people, if you're invited to a party, or you're invited to another party, or a wedding, or a celebration of some sort, or a birthday party, where you don't know everybody, and there's alcohol involved, don't go. We're in the middle of a pandemic, and people have to give their head a shake as well. So I understand the authorities who are responsible for maintaining order on Third Beach and elsewhere will be dealing with the situation there. But I would say this, that we also have personal responsibility, and I'm just as worried about parties that would take place in someone's home, where it's very difficult to maintain physical distancing. And we know these parties have gone on. Parties that take place in people's homes where they don't know people, where perhaps alcohol is being used, and sometimes vulnerable people, multi-generational people, seniors are in these homes. That's where we have to be careful. And so I say, have a great BC Day weekend. Go outside, go for walks, enjoy the sunshine. Don't spend too much time in the direct sunlight. And I just say genuinely, if you're invited to parties which are not controlled and you don't know everybody, don't go.
Mr. Anything like to add in closing?
I just like to thank everybody. You know, a lot of people who listen to Red FM, listen to your show, as you know, work in transportation, work in trucking, work in taxi, and those people are providing incredible service, uninterrupted service, and they've helped all of us. We've all been able to eat during this pandemic. Our grocery stores, there are a few problems with toilet paper at one time, but otherwise have been full. And
not anymore.
I just want to thank everybody, because I think when you see us doing the surgeries we're doing in hospital, that's because of all of those people who are listening to you right now doing their part. I just want to express my gratitude to you, because you've been a source of positive information and the information people need, and to everyone listening who have just been magnificent. Unfortunately, there's no cure and there's no vaccine, so we got to keep going well into 2021.
Minister, thank you very much for your time.
Hey, take care, Harjinder, anytime.
Thank you. BC ਦੇ ਹੈਲਥ ਮਿਨਿਸਟਰ ਗੱਲਬਾਤ ਕਰ ਰਹੇ ਸਨ। ਉਹਨਾਂ ਨੇ ਬੇਸਿਕਲੀ ਇਹੀ ਦੱਸਿਆ ਕਿ ਜਿਹੜੀ ਹਸਪੀਟਲ ਦੀ ਗੱਲ ਮੈਂ ਪਹਿਲਾਂ ਦੱਸ ਦਿਆਂ ਕਿ ਮੈਂ ਉਹਨਾਂ ਨੂੰ ਪੁੱਛਿਆ ਸੀ ਕਿ ਹਸਪੀਟਲ ਜਿਹੜਾ ਨਵਾਂ ਸਰੀ ਦੇ ਵਿੱਚ ਬਣਨਾ, ਉਹਦੀ ਪਲਾਨਸ ਉਹ ਕਹਿੰਦੇ ਸਮੇਂ ਸਿਰ ਚੱਲ ਰਹੀਆਂ ਨੇ। ਹੋ ਸਕਦਾ ਉਸ ਤੋਂ ਪਹਿਲਾਂ ਥੋੜ੍ਹਾ ਜਿਹਾ ਮੈਂ ਕੋਈ ਐਲਾਨ ਕਰ ਦਿਆਂ, ਪਰ ਦਸੰਬਰ ਦੇ ਵਿੱਚ ਉਹਦੀ ਬਿਜ਼ਨਸ ਪਲਾਨ ਤਿਆਰ ਹੋ ਜਾਏਗੀ ਅਤੇ ਮੈਂ ਉਹਦਾ ਐਲਾਨ ਕਰਾਂਗਾ। ਮੈਂ ਉਹਨਾਂ ਨੇ ਇਹ ਵੀ ਪੁੱਛਿਆ ਸੀ ਕਿ ਜਿਹੜਾ $2 ਬਿਲੀਅਨ ਮਿਲਿਆ ਹੈ, ਇਹਦੇ 'ਚੋਂ ਹਸਪਤਾਲ ਨੂੰ ਜੋਗੇ ਪੈਸੇ ਵੀ ਕੱਢ ਲਓਗੇ ਜਾਂ ਨਿਕਲੋਗੇ ਨਵੇਂ ਹਸਪੀਟਲ ਜਿਹੜਾ ਸਰੀ 'ਚ ਬਣਨਾ। ਉਹ ਕਹਿੰਦੇ ਕਿ ਪੈਂਡੈਮਿਕ ਲਈ ਅਸੀਂ ਜ਼ਰੂਰ ਕੱਢਾਂਗੇ ਉਹਦੇ 'ਚੋਂ, ਹਸਪੀਟਲ ਨਹੀਂ, ਪਰ ਪੈਂਡੈਮਿਕ ਨੂੰ ਕੰਟਰੋਲ ਕਰ ਰਹੀ ਇਹਦੇ 'ਚੋਂ ਕੁਛ ਪੈਸੇ ਜ਼ਰੂਰ ਵਰਤੇ ਜਾਣਗੇ। ਮੈਂ ਉਹਨਾਂ ਨੇ ਪੁੱਛਿਆ ਸੀ ਕਿ ਜਿਹੜਾ ਬੇਬੀ ਐਰੀਅਨ ਦਿਓਲ ਹੈ, ਉਸ ਨੂੰ ਸਪਾਈਨਲ ਮਸਕੂਲਰ ਐਟਰੋਫੀ ਹੈ, ਉਹਦੀ ਤੁਸੀਂ ਕੋਈ ਮਦਦ ਕਰ ਸਕਦੇ ਹੋ। ਉਹਨਾਂ ਨੇ ਦੱਸਿਆ ਕਿ ਅਸੀਂ ਇੱਕ ਡਰੱਗ, ਜਿਹੜੀ ਬਹੁਤ ਮਹਿੰਗੀ ਡਰੱਗ ਆ, ਉਹ ਅਸੀਂ ਜ਼ਰੂਰ ਇੱਥੇ ਮਨਜ਼ੂਰ ਕੀਤੀ ਹੈ ਅਤੇ ਲੈ ਕੇ ਆਉਂਦੀ ਹੈ, ਪਰ ਬਾਕੀ ਮੈਂ ਇਹਦੇ ਬਾਰੇ ਬਹੁਤੀ ਗੱਲ ਨਹੀਂ ਕਰ ਸਕਦਾ, ਕਿਉਂਕਿ ਪ੍ਰਾਈਵੇਸੀ ਦੇ ਕਈ ਮਾਮਲੇ ਹੁੰਦੇ ਆ ਜਿਹਦੇ 'ਚ ਮੈਂ ਸਪੈਸੀਫਿਕ ਕੇਸਿਸ ਦੇ ਉੱਤੇ ਗੱਲ ਨਹੀਂ ਕਰ ਸਕਦਾ। ਅਤੇ ਮੈਂ ਉਹਨਾਂ ਨੂੰ ਸਕੂਲਾਂ ਬਾਰੇ ਪੁੱਛਿਆ ਸੀ ਕਿ ਸਕੂਲਾਂ ਦੇ ਵਿੱਚ ਤੁਸੀਂ ਸੈਟਿਸਫਾਈਡ ਹੋ ਜਿਹੜੀ ਪਲਾਨ ਆ। ਉਹ ਕਹਿੰਦੇ ਹਾਂ, ਮੈਂ ਸੰਤੁਸ਼ਟ ਹਾਂ। ਔਰ ਉਹਨਾਂ ਨੇ ਲੋਕਾਂ ਦਾ ਧੰਨਵਾਦ ਕੀਤਾ। ਜਿਹੜੀ ਥਰਡ ਬੀਚ 'ਤੇ ਪਾਰਟੀ ਹੋਣੀ, ਉਹਦੇ ਬਾਰੇ ਵੀ ਗੱਲ ਚੱਲੀ ਸੀ ਕਿ ਉਹਦੇ 'ਚ ਹੋਏਗੀ। ਉਹ ਕਹਿੰਦੇ ਡਰਮ ਪਾਰਟੀ ਨਹੀਂ ਹੈ, ਪਰ ਫਿਰ ਵੀ ਮੈਂ ਕਹਿਣਾ ਤੁਹਾਨੂੰ ਸਾਰਿਆਂ ਨੂੰ ਹੀ, ਲੌਂਗ ਵੀਕਐਂਡ ਆ ਰਿਹਾ, ਜੇ ਕੋਈ ਤੁਹਾਨੂੰ ਪਾਰਟੀ 'ਤੇ ਸੱਦਾ ਜਿੱਥੇ ਸ਼ਰਾਬ ਵਰਤੀ ਜਾਣੀ ਆ, ਪਲੀਜ਼ ਜਾਓ ਨਾ। ਉਹ ਕਹਿੰਦੇ ਵੀ ਉੱਥੇ ਜਾਣਾ ਠੀਕ ਨਹੀਂ ਹੈ। ਇਹ ਸਾਫ਼ ਉਹਨਾਂ ਨੇ ਗੱਲ ਸਪਸ਼ਟ ਕੀਤੀ ਹੈ।
Thank you for listening to another Red FM podcast. Don't forget to hit subscribe and check out our Red FM Canada YouTube channel. For further info, log on to our Red FM social media platforms or visit redfm.ca.